20% of all Arkansans have no health insurance of any kind. And Arkansas is one of the poorest states in the nation. We're a very unhealthy state. We opened the clinic for medical service in December of '08, right at the peak of the economic crisis when things were all starting to fall apart around the country with jobs and with large corporations. And we were quickly overwhelmed. We started out as a walk-in clinic, allowing people to come in without an appointment, and quickly had to stop that because we had so many people coming in that our doctors were overwhelmed and couldn't see the number of patients that were being presented each night. So now our patients are on an appointment-only basis. We have 4 main criteria. You have to be a resident of Pulaski County, you have to live or work in Pulaski County. You can't have any insurance of any kind, no Medicaid, no Medicare, no private insurance. You have to be between 13 and 65 years old, and your income cannot be more than 200% of the federal poverty guideline. If you're single, you can't make more than $21,660 a year. It goes up according to the size of your family. If you're a family of 4, for example, you can make up to $44,100 a year. We have a lot of single moms that come through our clinic with 2 or 3 kids that are working, making $10, $11, $12 an hour that still qualify for our services because their income is not so high because of the number of children they have. The majority of our patients work. They hold down a job. They go in and out of the job market sometimes because of their chronic diseases. A lot of our patients, in fact, over half of our patients have either hypertension, diabetes, or both. And they get into a job that provides insurance and they're going well for a while. They're being able to stay on their medication. They either lose their insurance at that job, the employer doesn't provide it anymore, they don't feel like they can pay for it, or they lose their job and lose their insurance, and now they don't have their medication on a regular basis. So now that we're here, they can come to us, whether they're working or not. As long as they don't have insurance, we can keep them on their medication consistently. Now they're not in and out of emergency rooms for their health care.
We see a lot of people who are lost their jobs and they don't have any access to care and they don't have the funds anymore. I mean, we see people losing their houses every day. And health care, I've been a nurse since 1977, so I know that health care sometimes is what we let go because it doesn't seem essential until you're sick and you don't have any care to get anywhere.
We provide a larger array of programs and services than any other dental program in the state. We provide extractions, fillings, teeth cleanings, steel crowns, some minor oral surgery, and dentures. And to my knowledge, no other free clinic in the state provides that. A lot of our dentists go to mission trips to Haiti and Jamaica and Honduras and so on. And they tell me, our dentists say, that we see a lot of the similar conditions in these third world countries as we're seeing here in Pulaski County. We have people in Pulaski County that have never been to the dentist in their life, if you can imagine that. We have people coming into our clinic that are pulling their own teeth, and that's just something that most of us can't imagine. But they're in such pain, or because of their diabetes, their gums are deteriorating and their teeth are actually falling out of their head sometime. 3 times per year on average, our patients go to the emergency room to get their health care. And after they've been with us for a year, it's less than 0.5%, or less than half of one time per year. So we're keeping people out of the emergency rooms. We're providing them good quality health care on a regular basis with their medications, and improving not only their physical health, their oral health, but their financial health of their family, by helping them stay healthy, by helping them keep their job or get back into the job market. They're better able to provide for themselves and their family on a regular basis. So we're helping the hospitals, keeping people out of the ERs. And the hospitals in town refer to us on a daily basis. Some of the hospitals even transfer patients through their switchboards to our clinic when they found out they have no insurance and don't have the capability to pay. They'll send them to us. Most of the hospitals, in fact, all of the ERs in the 3 major hospitals in town provide patients that come in to see them with our eligibility forms and our name, address, and phone number saying, here, go to Harmony Health Clinic. They'll provide your follow-up health care. So we're doing a great service not only for our patients, but for the hospitals, the community at large, and we need some help back. We see everything you can imagine in our clinic as far as medical care and dental care. We have people presenting with just the common cold, with the flu. We have a lot of lung conditions. We have a lot of patients that are on inhalers and have lung problems. 55% of our patients have either diabetes or hypertension or both. So that is the two main chronic diseases that we see on a regular basis. We have patients with heart problems. We have patients that come in with staph infections that have cuts that have to be cleaned out and packed, and sometimes it takes multiple different kinds of antibiotics to kill that staph infection. We see an enormous range of things. We have people with present with cancer, with STDs. If you can think of it, we see it in our clinic. We've sent probably 13 patients to the emergency room that have presented to the clinic with a medical condition so severe that we couldn't handle it in clinic. And we called an ambulance and sent them to the emergency room with blood pressure 250 over 150, getting ready to have a heart attack or a stroke, that were sent to the hospital, kept in the hospital, and that came back to the clinic later for their follow-up care that said, you saved my life. And now you're going to provide the follow-up care, and I'll never be without my hypertensive medication again. We provide people life-saving insulin on a daily basis, people that if it wasn't for us, they wouldn't have that. And they're playing Russian roulette with their health by going in and out of their medication. Some of our patients have to make a choice to decide whether they buy their insulin this month, pay their rent, or buy food or clothes for their kids. And those are the choices that people are faced with on a daily basis that maybe most of us don't have to deal with and don't consider. But we have many cases of patients that their lives are saved, their lives are changed on a daily basis because of our clinic.
Well, I look at it from two aspects. One is, I'm a medical educator, and so if I can spend an evening or two extra here with some of my medical students, with some of the pharmacy students, with some of the nursing students, and have them or encourage them, empower them to recognize what impact they're making on their community, that's paying things forward to the next generation. I'm also setting an example for my own children, for the kids in my church, for the kids in my community, saying, it's not just about what money you make, but it's about the impact that you make in your community. But above everything else, you walk into this clinic on a Thursday evening, and you've got a waiting room full of patients, and every one of those folks, when they walk into the door of the exam room, when they walk out the front door, every one of them's got more of a smile on their face than when they came in. They recognize that they're important to somebody, and not just their mother or their sister or their brother.
Well, it adds to my life. I've worked for so long, and then when you retire, it's, you have to have passion, something to feel passionate about, and that's what I do here.
I believe that the more you give, it's kind of like what they say, if you have your hands open to give, your hands are open to receive. And that's in blessings and that's in life. And I think that in this community, the more we give and the more I share the blessings that I have because I give, and even in the hospital I work at, I have people who are willing to say, hey, can I volunteer too? Because it's not a bad, dreadful thing to do. You're giving back to society. I mean, we have to help each other.
We've had a dental patient that came in that we had to extract all of his teeth. And we were able to present him with a brand new set of full dentures, and he got a job within 2 weeks of getting those dentures put in his head. And he's got $1 million smile today.
For someone to come into this clinic, get a new set of teeth, and have the confidence to be able to go out in the world and sit down for a job interview and smile and exude confidence, that not only helps him, but it also renders, it provides for a more productive society because we're putting people back to work.
We had a gentleman who came in here one day to get care, and he was in obvious discomfort, was sitting here in the waiting room, and I think after he had gone through and had gotten care, one of the volunteers here patted him on the back and said, you know, I really hope you get to feeling better. And he said, well, I'll tell you, I felt better before I ever even saw the doctor. When I came in and was welcomed here, I knew that things were going to be okay. And that's what we want to be able to provide.
You know, we need two things primarily. We need medical professional volunteers, and we need cash donations. Even though we don't charge $1 to any of our patients to come and get this quality health care we provide, it is expensive to provide this for our patients. There is a cost. We have costs for medical supplies, dental supplies, for equipment, and we need donations in order to continue to expand and grow our program, because the need is not going away. Even though, thank goodness, the economy is starting to slowly turn around and improve, there are still many people unemployed, working, that have no insurance. There is still a great need for our services, and we foresee that need into the future. Dr. Martin Luther King Jr. said, of all the injustices in the world, lack of access to quality health care is among the worst. And we're here in Pulaski County providing access to quality health care for the patients that we see at our clinic, the patients that qualify. And we're going to be here for a while, and we need support, we need help, we need your help. We need the help of your business, whether whatever corporation you're with, if you're an individual, would like to donate. If you're a medical professional, we need your help. So please consider donating your time or making a financial contribution to Harmony Health Clinic today. Thank you.